Hi, friends. Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. I am going to be reading an excerpt, or not so much, probably paraphrasing from Stealth Health, my book, which was published in May of 2020. Now, it took me 2.5 years to write this. And so much of this book is so pertinent today. And what you need to know is that after 2020, when a lot of medical facilities were either shut down or slowed down or focused on other things, I see a lot of medical testing, a lot of excessive medical testing being recommended. We have to remember, and I mentioned this in the book Stealth Health, is that the vast majority of what appear to be private doctors' offices are actually owned by a large health conglomerate. And they have quotas to meet, and they have a boss to answer to. So they're trying to get back up to speed on meeting those quotas. So how to approach medical testing like a boss? Because remember, medical facilities work for you, and you are on a mission always to be healthier and more vital. And if you have a mystery to unravel, you are your own best expert. So if you haven't picked up a copy of Stealth Health, please do, because I'm going to talk about some things in here that are in previous chapters. So I'm on chapter 4, using medical testing to your advantage. And I discuss how the system has a hold of us, how the system has been making us sick our whole lives. And there are 4 specific questions you should be asking your medical professional if they recommend testing. Now, of course, you're going to walk in with a great knowledge already of what's going on with you, having done your own research. And of course, I explain in Stealth Health how to do that. So these are the 4 questions. Number 1, if this recommended test results come out normal, what's next? So the answer might be other testing. It might be merely a wait and see, or it might be referral to another conventional medical provider. Usually medical professionals are not going to refer outside of the conventional medical system. Again, the vast majority of times. Question number 2, if the results of this test come out abnormally, what does that mean? Now, the answers may be exactly the same. We're going to send you for further testing. We might do a wait and see, or we might refer to another conventional medical provider. And a lot of times medical testing is done to rule out a diagnosis. And I use the example in Stealth Health. If you've got a sore throat and they do a swab of your throat and send it to the lab, they're looking for strep. If the test comes out positive, yes, you have strep, and that means they follow a certain treatment protocol. If it comes out no, it's a different treatment protocol. So the test that you've done, if it is negative, they have ruled out, meaning there's no strep there. Now, here's I think the most pertinent question. If the test results come out as there's something there, what are my treatment options? And what are the benefits or adverse side effects that can be expected from treatment? So if the answer is yes, if those tests come out to find something wrong, we're going to recommend this drug, and you are really trying to avoid pharmaceutical interventions, the questions will be, what are the side effects? How long should I expect to be on that drug? Is it short term or is it forever? If surgery is going to be the result of the test and you want to do everything possible to avoid surgery, you might want to say, I'm not ready for surgery. I'm going to try some other options first. I don't want the test done. Same with the drug therapy. If you don't want to get on the drug path, you may not want to have the test done. Now, here's a caveat to that. Information is power. So these test results may give you information that you can add to what you already know about yourself, because you are trying to become your own best expert. And with that information, it may help you to find care at a different provider, a holistic provider, somebody that's outside the realm of knee-jerk pharmaceuticals and surgery options, because honestly, that's what conventional medicine has to offer. That's what they do. You can't fault them for that. Now, the last thing is you may want to ask about the proposed test. How invasive is it? Is there any dangers? And does a different, less invasive test exist to get the same information or maybe better information? And if you've seen my video on mammograms, you know exactly what I'm talking about. I think mammograms are barbaric, and I think women should be getting ultrasound tests, which give just as much information, and they do not abuse the breast tissue and create problems there. So take this book with you, take the questions with you, ask your medical provider when they're proposing these tests, because this is all relevant to you being in charge of your health, being your own best expert. So I hope that helps. If you have a question, please leave us a comment. Bye for now.